Welcome to the Hospital Finance Podcast, your go-to source for information and insights that can help you protect and enhance revenue at your hospital. And now, the host of the Hospital Finance Podcast, Michael Passanante.
Hi, this is Mike Passanante. Welcome back to the Hospital Finance Podcast. Today I'm joined by Meliza Weiner, RN, who is a clinical nurse manager here at BESLER Consulting. And I'm also joined by Miranda, who is the Director of Emerging Payment Models at BESLER Consulting. And Meliza and Maria have joined us today to explore the impact of patient satisfaction on alternative payment models. Welcome to the show, both of you.
Thank you, Mike.
Thank you.
So Maria, I'll turn to you first. Can you explain to us why patient satisfaction is more important today than it was even 4 or 5 years ago?
Sure, Mike. So patient satisfaction has always had an impact on the provider's business and bottom line because the patient's perception of your facility can keep them away. But chances are it won't keep them away forever. It would probably take a serious incident to make you not go to your local hospital in an emergency or to make you drive across town to another facility. I like to think of it like your cable company, for example. In my town, I only have a choice of 2 cable companies. I don't know too many people who actually love their cable company. And, you know, when you call, you get bounced back and forth, and chances are you wait about 45 minutes before you even get a live body on the phone. Having said that, if you have a choice in going to a facility for an elective procedure, such as CJR, or something not requiring you to be admitted, you might think twice. So for years, there's been a push to increase patient satisfaction. Hospitals and providers of all types have taken these initiatives on themselves because they realize how important it is to keep their patients happy. What we're exploring today, however, is there's been a change in the way that hospitals get paid. Patient satisfaction is now playing a direct role in how they get reimbursed. Basically, the advent of bundled payments and other forms of value-add programs include satisfaction in their quality scoring. And that's used to adjust their reimbursement. So going back to my cable company example, you might switch providers if you're really frustrated, but the price that you pay for that service is not going to change by how happy you are with your cable company. Unlike the cable company, if you're unhappy, your dissatisfaction will actually impact the hospital's bottom line.
Meliza, turning to you, can you define patient-centered care and how that can impact the culture of an organization?
So, Mike, back in 2015, the Institute of Medicine defines patient-centered care as providing care that is respectful and responsive to individual patient preferences, needs, and values that guides all the clinical decision. In a nutshell, Mike, the patient has to be in the center of any care provided. So historically, healthcare organizational culture have always been created and led by healthcare professionals based on what is considered the best for patients, and rightfully so. But how about involving and considering what the patients think? For example, pain management. Everyone's pain tolerance is different. I, for instance, have a better pain tolerance than my husband, and he has a better pain tolerance than his friends. So I assume that the same pain regimen would work, even if we had the same procedure like a total knee replacement. There are many factors to consider when it comes to pain management. Another is patient education, which are at times written in medical terminology that is understood only by healthcare team members, and most times done on the day of discharge with the discharge instructions, even 30 minutes to 1 hour before the patient leaves. This does not give enough time for the patient and the family to comprehend and ask questions. A patient-centered healthcare organization makes the patient's needs be in the front and center, especially when creating, designing, and streamlining their processes and procedures as it relates to patient care and experience. All members of the healthcare organization, especially direct hands-on care team members, need to focus and tailor their efforts to meet the patient's specific needs. So going back to my example earlier, asking the patient where they would like to be in the pain scale as far as pain relief, and giving a patient time to ask questions about their health and treatment plan while providing education throughout their stay, or better yet, ask them how they would prefer to be educated. I myself learned visually, would lead to an effective pain management and plan of care, a better overall perception of care, thus better patient satisfaction.
Maria, what role does patient satisfaction play in CMS's new mandatory payment models?
So, Mike, as we've discussed several times before in prior podcasts, the HCAPs, which is the patient satisfaction measure, is one of three measures that's used to calculate the hospital's total quality composite score for CJR. It's also going to be used to calculate the quality composite score for the new EPMs for AMI, CABG, and SHIFT. So using CJR as an example, HCAPS is weighted at 40% of the total score. So it can represent as much as 8 points for the hospital. Additionally, if the hospital's HCAPS national percentile for the period being measured at reconciliation is at least 2 deciles higher than it was the same period the prior year, the hospital will also get a 10% quality improvement bonus. So, for example, if a CJR participating hospital got over the 92nd percentile for HCAPS and the hospital only ranked at the 70th percentile for the same period in the prior year, then that hospital would not only get the 8 quality points for their HCAP score, they'd get an additional 10% or 0.8 for quality improvement that gets added on. So the SHIFT model will follow the same methodology as CJR, also weighing HCAPs at 40% of the total score. AMI and CABG will each weigh HCAPs at 20% of the total score. So whether we're talking 20% or 40%, it's obvious that HCAPS is going to be able to move the needle in calculating your total score and determining which level the hospital is going to fall into. And we've discussed before as well that there are 4 different categories: excellent, good, acceptable, and not acceptable. And that's also going to determine the hospital's eligibility to even receive a reconciliation payment, as well as it will determine the ultimate percentage discount that will be taken on their target price at reconciliation.
Meliza, you've been frontline with patient care. Can you talk to us about some of the strategies that hospitals can implement to improve patient satisfaction?
Well, sure, Mike. Well, you would love to know that there are multiple strategies that healthcare organizations have planned and, better yet, have implemented already. I think the first thing is to find out what the patients are telling them. Most healthcare organizations are using public reporting data, such as HCAPs, like what Maria had mentioned, patient surveys, and patient rounding to gather feedback in order to strategize on the opportunities for improvement. So I'll give you an example. If 90% of the patients are not satisfied with the call bell response, then that's an opportunity for improvement. The next move is to develop ways to fix it. So for example, about the call bell. An improvement strategy could be to ensure that a call bell answered in the first ring, or no one passes a room with a call bell ringing. Some healthcare organizations call it the no pass zone. Or better yet, be proactive in that before any team member leaves a patient room, make sure everything is done and ask if there is anything else they would need. There are numerous strategies, but what's important here that we need to remember is to take into account what the patients are saying, what they're thinking, what they're feeling and expecting. In addition, any improvement strategy developed must be consistent and carried throughout the organization.
Is employee engagement important for patient experience?
Absolutely, definitely. There have been multiple studies, evidence-based research, surveys that demonstrate how employee engagement affects the patient experience. Basically, an engaged employee is an employee who is aligned with the vision and mission of the healthcare organization, which encompasses excellent quality care, patient satisfaction, and patient experience. You see, Mike, when employees are engaged, they are empowered to ensure that the organization's core values are delivered. Simply put, they will do everything they can in order to deliver the care and services to meet the organization's goal, thus fulfilling its mission and vision.
Maria, I want to turn back to you. Can you help explain how data can improve patient satisfaction scores?
Sure. So as we've been saying, the HCAPs is monitored and reported on a quarterly basis. It's helpful for you to improve because it's something that you can trend. It's not real time by any means, but it's not so outdated that you can't monitor the improvement, as opposed to the risk score that's updated once a year. HCAPs is quarterly. So the HCAPs is broken out into several distinct categories, so it's easy to drill down into the problem areas and make specific improvements. So as with anything that's measured, Mike, you can trend the data to see if you're going in the right direction, and you can share that data and be completely transparent with everyone that's involved. So some hospitals say that how you collect the data can also make a difference. Some hospitals believe that they get more positive responses on their HCAPs when the interaction is personal, via phone call or in person, because patients hesitate to give negative feedback to a live person. Or maybe their response won't be as harsh as if they were just completing a form.
Maria, you mentioned HCAPs, and we know that's a commonly used measure for assessing patient satisfaction. What can you tell me about that measure?
So with HCAPs, there are 11 different items being measured. It's important to understand how these data points are being used in the calculation and how much weight each one holds. It's important to be as transparent as possible when trying to make improvements and share the data with everyone involved. Because you need total engagement and commitment in order to get that improvement. So I mentioned the 11 different items. There are 7 that are considered composite measures. There are 2 individual items, and then there are 2 global items. For the purposes of CJR and other CMS bundles, the composite measures are weighted at 100%, while the individual and global items are weighed at 50%, to arrive at the HCAPS linear mean roll-up score. It's important to note that as part of the final rule for EPMs that just came out in December, CMS removed the pain management composite measure from the calculation of the HCAPS linear mean roll-up score. This change will go into effect for performance year 1 of the CJR program, and it will be the method that's used for the other EPMs as well.
So I want to drill in on something you just said there. Why was pain management removed from the calculation of the linear mean score? You would think that's an important factor in determining patient satisfaction.
Yeah, and it is. And while CMS believes that pain control is an important part of routine care, they want to avoid confusion about the appropriate use of the pain management dimension questions. And they're trying to balance that against the very real public health concern over opioid epidemic. CMS does not believe that there's any empirical evidence that shows that the lack of prescribing opioids actually reduces the HCAPS survey scores. So to be clear, the pain management is still being measured. It's still very much a part of HCAPS, but in terms of these episode payment models, that measure is being removed from the calculation.
Thanks for clearing that up, Maria. Meliza, my last question is for you. How can a hospital or health system strike a balance between improving patient satisfaction scores and managing expenses?
Well, Mike, it's a misconception to think that spending more money is going to improve patient satisfaction. I think what is required is having organizational leaders engage their employees in a manner that helps the employees understand how their actions or inactions can have an impact on patient satisfaction, patient experience, and the overall organizational goals, which frankly includes finance. So for example, having the staff understand how not being responsive to the call bell will lead to a low patient satisfaction score, which in turn affects the patient's perception of care, or lack thereof, the patient's likelihood to recommend, and thus ultimately affecting the organization's reputation, their growth, and reimbursement. It all ties in one circle, Mike. What needs to be understood is that finances is as an important aspect in a healthcare system like any other business company. So it is critical for not just the leaders to understand the financial impact of their operational management, but even the frontline employees need to understand how they affect the bottom line.
That's great. Meliza and Maria, thanks for stopping by today and helping us understand more about patient satisfaction scores.
Great, thank you.
Thank you.
Hospitals can take many actions to increase their success with any of CMS's episode payment models. To learn more about how your hospital can succeed with EPMs, visit BESLER.com/EPM to download a new special report entitled 3 Ways to Succeed under Episode Payment Models. This report briefly discusses EPM programs currently offered by CMS, strategies hospitals can employ to succeed under these new programs, and how to use data to understand your hospital's performance. Download the report at BESLER.com/EPM.
This concludes today's episode of the Hospital Finance Podcast. For show notes and additional resources to help you protect and enhance revenue at your hospital, visit BESLER.com/podcasts. The Hospital Finance Podcast is a production of BESLER Consulting.